PeaceHealth's telemedicine program plays a vital role, ensuring patients have access to the highest quality care regardless of the patient's location. Specialists at distant sites can observe and interact with patients and families in their local communities. Together with local providers, the best course of care can be determined, including whether a patient needs to be transferred to another facility. In the following scenario, a young diabetic patient was brought to the emergency department at Cottage Community Hospital. The physician decided to consult with a pediatric specialist at Sacred Heart Medical Center at Riverbend in Springfield, Oregon.
He's going to need to be admitted to the hospital, okay, and we're not okay to keep him here in Cottage Grove. So we're going to have to transfer him up to Riverbend. Now, in order to accomplish that, I'm going to ask that one of our doctors join us by telemedicine so they can see him right now while he's in the department and they can help guide our management, okay? So we'll go ahead and get that set up. We're going to continue to treat him, okay? So he's getting treatment now, but we're going to get that clarified and sharpened with the consult.
Pediatric and Adolescent Unit, this is Pam. Yes, I will relay the information to him. Thank you. Dr. Bressa?
Yes, ma'am.
Dr. Kranix from Cottage Grove Emergency Room would like to talk to you about a telemedicine consult.
Oh, on consult or on the phone? You want to do telemedicine?
Telemedicine.
Okay, where are we set up for that?
Down the hallway.
Okay, let's go.
Okay.
So this is our telemedicine unit here, okay? And this is Dr. Bressa that I have online for us, and he can actually see us just as we see him. Dr. Bressa, can you hear us okay?
I can hear you, Danny. Thank you.
All right. So this is Elias, and Elias has been sick for about the past day. He's been throwing up, been drinking a lot, been urinating a lot. He's got sort of the classic picture of DKA. His ketones are high, his sugars are real high. I've got some questions that I wanted to ask you about acute management here in the department, and then as well as definitive treatment, probably going to need to be transferred. So he's we've got him on an insulin drip, but I was curious as to whether you wanted him bolused, and I also wanted to ask if you wanted him alkalinized at all. His pH right now is 7.26. His bicarb is low. His potassium is fine at the moment.
Okay, thank you. So as far as with kids, Danny, generally we don't like to do an insulin bolus with them because it drops their glucose too fast, and we find that they just respond really well with just the fluids in of itself. So I would just stick with an insulin drip of 0.1 units per kilo per hour, and I would just, you gave 1 liter of saline, I'd give him another liter. I could see right now that he's doing a lot of small respirations, so I could tell that his pH is pretty low just by that. And so let's just stick to the insulin drip, give him another bolus of fluids, and it's pretty clear he needs to come up here, and we'll take care of him. And this is Mom right here.
Yeah, this is Mom. Her name is Noni.
Hi, Noni.
Look, I think she had a couple of questions she wanted to ask you also.
Hi, Noni. I'm Dr. Barres up at Riverbend. Do you have any questions about what's going on with your son Elias today?
I do. Why is he breathing so fast?
He's breathing that fast because of his diabetes, and when your pH in your blood is low like that, largely due to him being dehydrated from his diabetes, it makes you breathe that fast. So it's not a problem with his respirations or his lungs. He's just really responding to the blood chemistry that he has, being his blood pH being too low.
Will I be able to stay with him?
You'll definitely be able to stay with him. We have a spot and a day bed for you to be with him. In fact, we would prefer you did stay with him. This is kind of a scary time for him, and I'm sure for you. And we want you to be here and be a big part of his care. Okay?